I know oftentimes people think, oh, this really only applies to elderly people. I don't think so. I know personally my future brother-in-law is very hard of hearing. He had some kind of issue, and I believe it's genetic because his father has the same issue, that, at 23 years old, he can barely hear me depending on where I stand. I believe it's his left side. I want to go with the left side of his head. He just can't hear. And I've said to him, Jake, you're going to need a hearing aid by the time you're like 30. And the number one thing that Jake and many other people across the country will say is, no way, I'm not spending that kind of money. And look, insurance isn't going to cover it. And that is the reality. Nearly 48 million Americans have some level of hearing loss, but the high costs of those devices to make it so that they could hear better, it's just not worth it for them. So they go on and they don't actually get hearing aids because it's just far too expensive. Well, that all changed. As you all know, this was top news that for the first time, people with hearing loss could soon buy hearing aids without needing to get an exam, have a prescription, or have a special fitting done first, thanks to the FDA. But here's a question this morning. Does that mean we're going to see a drop in hearing aid prices? And if so, why did it take us so long for this to happen? So to give us some perspective this morning, Paul Seegert is here. He's a managing partner at PCS Advisors, which is a health benefits consulting firm with 35 partner offices across the country. Paul, welcome to the show. Good morning. How are you?
I'm doing great. Thanks for having me.
So tell us, Paul, in your professional opinion, what you've seen with clientele over the years when it comes to hearing aids.
Well, you've outlined it pretty well. When hearing aids cost as much as $5,000 and are that inaccessible, you end up with the situation that we have today where you have 40 million Americans who could benefit from hearing aids but don't have the ability to get hearing aids because of the cost. They're just out of reach, which leads to all kinds of other problems in the system. And that includes dementia. 8% of dementia cases come as a result of people who have hearing loss but don't have the right equipment to deal with that. And it's a problem that we've recognized in the system for a long time. And there's been discussion even as far back as the Obama administration about fixing this and getting some free market forces to come to bear to drive down cost. And it's good that we're here, but it's also makes you scratch your head and think, why did it take this long to get here?
Yeah, I mean, give us some perspective, Paul. In your professional opinion, hearing aids, have they always been ridiculously expensive? And has insurance always, for the most part, said, listen, we just can't cover it?
Yes and yes. And the other issue that you have is that, you have this reality that it's not a covered item, and it was controlled, kind of an unintended consequence of the regulations that were in place. It was controlled by a small number of companies, similar to how we have 3 pharmacy benefit managers that control most of the drug formularies in this country, which leads to elevated costs compared to peer countries. We saw the same thing in the hearing aid part of our business, where you had 4 companies prior to this ruling that controlled 84% of that market. When you have that lack of competition, it certainly doesn't drive down costs.
Sure. Oh, absolutely. Markups are going to happen. Were hearing aids, though, always as expensive as they are today?
Well, no, but they've gone up, like so many things in healthcare, faster than inflation. And that's made them out of reach. Healthcare inflation, anything related to healthcare usually runs 2 to 2.5 times the rest of the economy in terms of inflation. It's one of the few areas where, unlike so many other things, when you have advancements, it adds cost. You look at technology outside of healthcare, and oftentimes it brings down cost because it increases efficiency. And in our industry, unfortunately, it is seen as an opportunity to inflate cost many times.
Mm-hmm. And Paul Seegert is a managing partner at PCS Advisors, which is a health benefits consulting firm with multiple partners, offices, I should say, across the nation. And we're talking this morning about hearing aids. This move by the FDA, I'm wondering, Paul, in your professional opinion, do you think it's going to result in a drop in hearing aid prices? And if so, why do you think it took us this long to get to this point?
I think it will. I believe we're going to see new competition come in, and we're going to watch the price go from $5,000. It'll push down considerably. It will not shock me that if we were to see that fall by literally thousands of dollars in the near future. And like to the second question that you had there, why did it take so long? Unfortunately, I get asked a lot, when are we going to fix the cost of healthcare in general in this country? And this certainly falls under that umbrella. And unfortunately, the answer is as soon as lobbying is no longer effective. It really was the industry itself and this oligopoly of companies that controlled a large market pushing back in Washington against change that really slowed it down. So that's an unfortunate answer, but it's the way this business works.
So I'm curious, Paul, when you hear over-the-counter medication. So when I go to like a pharmacy or even a supermarket, they always have marked down versions of I'm trying to think of the right way to put this, but like you could go, for example, to a chain supermarket and it'll show, this is our version of like what Advil would be. Right. When you hear over-the-counter hearing aids, could you give us an idea of what exactly that means, like what the quality would be for people who are saying, hey, I'd like to save the money, and if this would allow me to get hearing aids at a quicker time and at a smaller price, I'm going to jump on it. But what does that mean for, like bang for your buck?
Oh, I think quality will be as good or more. Competition is a good thing. And what we see in the healthcare industry is that in so many cases, the waste that's attached to the cost of an item or a service is not being attached to that item or service by the person that's creating it or making it. It's other middle players, and that's true here as well. You have this small number of specialists in this country that would take a hearing aid, do the fitting and all of that. Well, they would inflate the cost 3x what it costs to actually make that hearing aid. We could take the very same hearing aids that are getting to market today. The manufacturers could not only make the same amount of markup as they are going through that limited distribution, but they could expand their reach. 40 million more customers are waiting. So I don't think it's going to be have a negative impact on quality. I think we're going to see the other occur, and then you're going to have other companies get into the mix because the opportunity to fight for 40 million more customers is enticing.
Mm-hmm. It's a good problem to have. Paul, hold on one second. We're just going to take a quick break for traffic and weather on the 6s, but then we'll continue the conversation on the other side of this right here on WICC. Don't go away.
We want to hear from you. 203-333-9422. You're listening to Melissa in the Morning on WICC 600 AM and 107.3 FM.
Paul Seegert is here, who's a managing partner at PCS Advisors, which is a health benefits consulting firm. Has dozens of offices across the country. And we're talking about hearing aids, over-the-counter hearing aids. And Paul, during that break, I actually got a call from a listener asking, how can you buy hearing aids over the counter if you don't have a test ahead of time? Which I would think is a common question from a lot of people who are used to the way things have always been when it comes to getting hearing aids.
Yeah, it used to be that you did have to do that and get fitted. That will still be true if you have severe hearing loss, but if it's mild to moderate, then they're already have developed products and systems and have been waiting for this ruling where you could self-fit, so to speak, and there'll be instructions and so on that you can follow to do that with the devices that they are waiting to get to market.
That's amazing. It's amazing what's kind of going on behind closed doors and just sort of waiting in the wings until they can step on stage, right? I mean, that's incredible.
This is going to be a big breakthrough for lots of people.
So I'm curious also, Paul, you and I were talking before the break about how you feel the quality is not going to go away. In fact, the quality is going to be better than what may be on the market today. So I'm curious, like, what kind of a price cut we can really expect from over-the-counter hearing aids. You know, when you talk about great hearing aids being somewhere between $3,000 to $5,000, and yet the quality is going to be the same, if not better, with these over-the-counter. What kind of price cut can we really see?
Well, Harvard, folks at Harvard, their Harvard Health Publishing program out of their medical school, they are anticipating, based on their own research, that costs could go down to about $600. And when you compare that with $5,000, that's a huge swing.
Huge difference. Wow. Now, I'm also curious because you were saying that this could really change the course of time for hearing aids going forward. So, okay, it changes the prices and maybe competitors want to, get their want to throw their hat into the ring, or maybe, the ones who are currently on the market, they want to drop their prices significantly. Fine, no problem. Do you think there will ever be a time, though, where health insurance covers hearing aids? Because, sure, $600 compared to $5,000, huge difference. Absolutely. But there are still people across America who are going to go, $600? Oh, I'm not doing it. Not going to do it.
Yeah, if it were me, I would say I don't think so. If you're, asking me to make a prediction in this case, knowing the industry, I doubt the industry is looking to take on an additional cost. If they do, and honestly, my answer is somewhat surprising to folks in this area sometimes, because I think we're going to be better off if it doesn't get covered by insurance in some ways. What I mean by that is the fact that when the procedure gets covered by insurance and the consumer is only responsible for a copay, what we watch is whatever part of the industry is providing that service or product elevates the cost. And then it exacerbates the problem of premiums going up each year faster than inflation. Insulin's a great example of that. We just passed, as part of the Inflation Reduction Act, the copay for insulin will get maxed out at $35 for those on Medicare in the future here. What they didn't address was the total cost of insulin. So more of the cost of insulin will get pushed into the premium itself, which will increase the premium for Part D for those on Medicare. So you have these, it's just, you're squeezing a balloon sometimes. And what we can say is if you look to things like LASIK, some cosmetic procedures, other things in this area or in this industry where the insurance payment model is not involved, you tend to have increased competition and decreased cost. You have classic free market forces going to work. When we have an insurance payment model in the way or involved where the share of cost that's borne by the consumer has no relation to the total cost, then we get, frankly, misbehavior by players in the industry. I think we're going to see that fairly soon here as the government stops paying for COVID vaccines, as an example, and starts to push those into insurance plans, which is imminent. We're going to watch these manufacturers charge the insurance plans significantly more than what they were charging the U.S. government. So costs of vaccines will rise. We won't see it necessarily as an individual. Maybe we'll have a small copay, maybe we'll have no copay. But what are they doing behind the scenes to inflate cost in the system overall is oftentimes my biggest concern, and I think it could apply here if we push this into a benefit that's covered by your insurance.
Right. You have junk in one closet, and just because you move it to another, sure, you cleared out that closet, but now it's just moved elsewhere. It's a really good point.
Right.
Really good point. Well, Paul Seegert, I really appreciate getting your perspective on this massive story that is going to impact millions of Americans, including here in Connecticut. I thank you so much for your time this morning.
Thanks for having me. Have a great day.
Thank you. You too. That again is Paul Seegert, who is a managing partner at PCS Advisors, a health benefits consulting firm that has partnering offices here and across the country.